on WGPF AM. And good morning, hosts. Our hosts, Leah Drake Stith and Thomas the Colonel Chapman. Of course, I'm yours truly, James Slim Overton. Good morning, host.
Good morning, James.
Good morning,
And Colonel.
Leah.
And Dr. Washington. Good morning.
Good morning. Good morning.
Yes.
Believe it, we're in the month of December. And last year, this time, we launched the Portsmouth Coffee Talk format.
Yes.
It's been a year already. So all month we'll be celebrating our 1-year anniversary as Portsmouth Coffee Talk hosts. So happy anniversary
Yes.
to my host.
Yes.
And happy anniversary to you too, James.
Yes. And happy anniversary to both of you.
Yeah. So you'll hear more about this as we go through the month. But anyway, our special guest this morning is no stranger to, the original 7 Cities Forums of Hampton Roads. She was my guest in the studio a few years back. And we'd like to welcome Dr. Darlene Sparks Washington. Good morning, doctor. How you doing?
Good morning. I'm doing well. Happy anniversary to the team.
Thank you.
Yeah.
Thank you. Good morning to you.
Thank you.
Good morning.
Of course, Dr. Washington is Executive Director of the Portsmouth Volunteers for the Homeless. She's a graduate from IC Norton, Hampton University, and attended York College of,
New York College of Podiatric Medicine.
Myriad College? Myriad
New
College.
York.
New York.
New York.
New York College of Pediatric Medicine and Podiatric Medicine. And she's worked with the Red Cross and consulting firm, but now she's here back home in the city of Portsmouth. As I mentioned earlier, Executive Director of PVH. And, we're so glad to have you back as our guest. And I'm going to let, I'm going to ask the Colonel to start off our discussion because first he has a disclaimer he has to put out there.
Oh, yes. We got to get this disclaimer out there. The views that are expressed on this show are of those of the host and guests and not of the radio show. So I need to get that out there and especially for me, because sometimes I may go off to the left land a little bit. So I need to get that out there. So are we opening up for questions now, Slim?
Yes, go ahead.
Yeah, okay. Dr. Washington, I see you're a Hampton grad.
Yes, sir, I am.
Yeah, so I just happen to be a Hampton grad myself. And
Pirate Nation rocks.
Yes, we rock. So could you start off and explain just a little bit about your organization before we start the question and answer period and information period?
Yes, thank you so much for the opportunity to share. Portsmouth Volunteers for the Homeless is a nonprofit organization. The organization was actually, the inception was in 1990, and it was a group of downtown churches who felt that they no longer wanted to see individuals or could stand to see individuals sleeping outside during the winter months. And so they created this program to bring individuals into their sanctuaries. Fast forward to where we were pre-COVID, we were an agency that collaborated with a total of 30 organizations, 25 which were faith communities, to provide shelter for individuals who were experiencing homelessness. The shelter would run from mid-November until the beginning of May. We also operate a service center at our office, and that's a place where individuals can take a shower every day, do their laundry. We just believe that if we can help people to create a sense of hope, then they can believe that they can accomplish the tasks necessary to become rehoused.
Yes. How do you all fund each other, your organization? How is it funded?
Well, we try to keep our funding diverse. So we get a little bit of funding from the state. We get a little bit of funding from the city. And then we are always tapping into other grants with foundations, corporations, and then we have a set of churches that support us, and then we have our general community fundraising.
Good. You know, while we're talking about funding and everything, and me being a retired Army, I look at, do you partner with or do anything with the homeless veterans out there that are walking the streets and have the behavioral health problems that make them chronic homeless, because some may not, you know, they have other things going on? And
absolutely. Within the city of Portsmouth, there is a continuum of care. And that continuum of care involves providers with different areas of expertise and specialty. And we have one provider who actually is funded to service our veterans. And so whenever we go through our coordinated entry process and a vet is identified, they get an immediate referral to that agency.
Okay, good, good, good. You know, as time goes on, and we've witnessed an historic election where we have the top 3 seats in the state government is changing for the negative part, and I'll have to add that in for the negative effect. And they're already talking about law and order and bringing in budget cuts. And what do you expect for how that's going to affect your organization and the actual caring for the homeless out there from the state now? Because we expect to have more of this cut back once he takes office.
Absolutely. A portion of our funding does come from the state. We have very, very strong partners and very strong advocates at the state level. And so we anticipate that they will be advocating for every penny that we can get to increase and to maintain and sustain funding. That being said, we always, when you're operating with soft money, you have to be ready to spring into. And so we have spent a lot of time cultivating our individual donations and hopefully growing our corporate support as well as our faith community support.
Well, you know what, and I don't want to monopolize it, our conversation, but I look at, you know, what happened over the last year with the pandemic, and especially when you're housing of the homeless, and then you're putting people in shelters and where you have to have the 6 feet or by CDC guidance or whatever. How'd that affect how the pandemic affect the organization and housing of our homeless out there?
It certainly had a large effect. I remember it very clearly, March 2020, when things just started to close up, and we were kind of coming out of a 7-day with one of the churches who had an edict to, you know, close the doors, and they said, you know, stay, we're going to give you a chance to try to figure out what your next move was going to be. And serendipitously, in January of that year, I had been approached by our Sheriff Michael Moore, and he said, I really want to talk about ways we can partner and maybe serve as overflow. So now March is coming and we have no place to go. So we approached the sheriff again, asking, well, you know, now is that time to exercise that offer. And it, you know, in less than 24 hours, it was absolutely okay. And so we created this new partnership with Sheriff Michael Moore and the Portsmouth Sheriff's Department, where we were actually able to go into a building that was not occupied at that time. And we've actually been there since March of 2020.
You know, that is so great, you know, and we were talking earlier, and I like to see people with vision, and Michael Moore is one of those with vision.
Yes, he does.
Cares about people. He cares about people, and which is a stark turnaround from the previous guy that was there. I don't want to even mention his name. But my last question would be, what gets me when we look at the homeless, And throughout, and this is just not in the city of Portsmouth, but this is all throughout the region, are professional panhandlers out there. They claim that they're homeless. And I see the professionals, the ones that, there's some that I pick out every day when I go to Walmart or whatever. They got the signs out there. But if I go out there at 5 o'clock just before the sun goes down, I see them folding up the wheelchair and getting into the nice car, better car than I drive. And what does that do to the atmosphere or the PR piece that, you know, that you're trying to get over, you know, with the people?
I'm so glad, Colonel, that you made the distinction, because there is a distinction between being homeless and panhandling. And sometimes the lines get blurred. For the most part, individuals who are homeless and working to get themselves back on their feet will avoid panhandling, because they don't want that sense of pity or shame, and they don't want to risk getting citations while they're trying to rebuild their lives. There are absolutely panhandlers. It's difficult to tell the difference. And what I honestly tell people to do is to follow your heart. So however your heart leads you, if your heart is, you know, has some trepidation about it, then, you know, pass it on by. If your heart really is speaking and you think this individual really needs the help and you give, once you give the gift, it's between them and the God of their understanding. You giving it is between you and the God of your understanding. So,
Dr. Washington, tell us please what services are provided at the shelter for the homeless.
So in addition to the shelter, which is trying to keep a roof over a person's head where they can feel safe and receive a hearty dinner meal, we also operate the service center. And again, everybody deserves the dignity of being clean and being able to present themselves to the public in clean clothing. So those are services that we provide. We also provide referral services. So at onset in our intake, we start to identify what needs the individual has and what barriers they believe that they need to overcome in order to be rehoused. And from that, we begin connecting individuals to resources. So whether it's mental health or substance abuse, or whether it's a legal issue. We pre-COVID legal aid would come in twice a month to work with individuals on non-criminal issues who qualified. So we try to take a holistic approach. Substance abuse isn't one of our major areas. However, we have driven clients to the Healing Place in Richmond. We have driven clients to the Phoenix House in Arlington, Virginia. If that's the barrier that's keeping you from becoming housed, then we want to problem solve with you in terms of identifying resources.
Okay. Are there case managers involved?
We personally
that are provided?
We personally do not have official case managers on staff, but we do make referrals to partner agencies that have case managers.
And one last question, James, before I move on. I know that you provide food for these individuals. What meals are provided? How do you provide those meals for those individuals?
Well, we actually do provide dinner meals, and we have snacks, of course, throughout the day, but we provide dinner meals, and usually we're identifying a caterer. Right now we do have a caterer that provides the meals, but we also may go out into the community to restaurants and cater their dinner meals as well.
I did say the last one, but one more, James, I promise you. How do you determine the individuals who will be brought into the shelter? Because although we know we have the shelter there at the sheriff's location, at the work center, when you walk downtown Portsmouth, you still see a number of homeless individuals. And I know many of them appear to have mental health issues. So how do you make the determination as to who will be allowed into the shelters?
So we have a pre-COVID and a post-COVID model. Pre-COVID, when we were working with the churches, it was to our capacity. So on any given night, we could have 40, 45, 50 people in based on the capacity of the facility that we were in. Post-COVID, as Colonel mentioned earlier, now we have to have space. So we have to have social distancing and proper public health protocols in place. So we had to focus on the most vulnerable, whoever had the highest vulnerability. So in addition to being homeless, what was their mental health status, their medical issues, age, gender, substance use. So we are a low barrier. That means that you don't have to be sober, you don't have to be medicated. We focus on behavior because again, everyone deserves to have a safe space to sleep at night. Now, we can't force individuals to come into shelter. They have free will and they can choose to be outside if that is their choice. So that's why you will always see individuals out and about and not necessarily in a shelter that's provided.
Mm-hmm. Yeah, good point. But before Slim, you jump in there, and I know you're dying to jump in there, I need to get one more point in there, is that when we talk about barriers and need for resources, for those who are out there in electron land, if you'd like to hear this program and the programs that we broadcast every week, we also need the resources so we can continue on doing what we're doing. So you can send a honorarium, or you look for a sponsorship, and you can send it to Portsmouth Coffee Talk at P.O. Box 7664, Portsmouth, Virginia 23707. And then, so as I say that, and I'm listening to Dr. Washington, I would like to tell everybody, even post-COVID or pre-COVID, everybody, I mean, everybody is only one check away from being homeless. That's true. And COVID really brought that to bear because people were locked out of their houses and lost their jobs all in the March of last year, and it was an awakening. And so so if you're going to donate, organizations like what Dr. Washington has are prime examples of where you should funnel your monies to and look for the help. And so if I wanted to donate to you, how would I get to you, Dr. Washington?
So Colonel, donations can be made on our Facebook page. So there's a donate button and you just press it. All of that goes to Portsmouth Volunteers for the Homeless. Facebook does not take anything off of any percentage or processing. Also, you can mail checks directly to us, Portsmouth Volunteers for the Homeless, 800 Williamsburg Avenue, Suite B, Portsmouth, Virginia 23704. Thank you.
Okay, first I'll say to my host, I appreciate you. I appreciate you. I learned from your questions that our guests have to answer. So it's no problem. We're a team here. Yeah. But anyway, Dr. Washington, can't help but notice the red attire you have on. So in saying that, I like to mention that you are a member of the Delta Sigma Theta Sorority Incorporated. And we always like to mention or recognize the Divine Nine when we have them here as our guests. So you're representing well. So because I see your sisters sort of lined up here, throwing the signs up. But, but anyway, my question is, the city initiated, or I believe it was the city or maybe the state initiated a 10-year plan to end homelessness. Now, my question is, were your organization involved in that? And if you were, where are we now with that particular plan?
So The 10-year plan was actually created prior to the time frame that I came on. I came on in 2016. And at that point, I think they had revisited with the 5-year plan. And so what we're now doing is revisiting that 10-year plan to see where we are. So much has changed in the area of homelessness since that 15 years. And so we're rebuilding that plan. Again, as I stated before, Portsmouth has a Continuum of Care, and it is an agency called PHAC, Portsmouth Homeless Action Consortium. And all members who are funded either through the state or federal funding sit on that continuum of care. And we coordinate services as well as help prioritize the resources for individuals who are homeless.
Yeah, and you know, it's been reported that Portsmouth is like 18% poverty. And poverty doesn't necessarily mean homelessness. A lot of those things, the homeless rate is much lower than the poverty rate, because poverty means a whole lot of other things. We have working poverty, and we also have people that are homeless or working. My experience one time working at the church, and you encourage, if you work in the church, and I thought it was a great idea for us to sit down and actually talk to the people that we were serving, so they would not feel like, okay, we're here, we're serving you, but we don't want to. So, and to sit down and interact with the people, you find out your perception of what homelessness is completely different, because a lot of those people I talked to had jobs. And once they left that church, the next day they were going to their job. But for whatever reason, they were in a homeless situation. So how much do you link poverty, to homelessness? And, because a lot of people just see it that one way, the poverty rate at 18, but it's not that high for actual homeless numbers in the city of Portsmouth.
Yeah, absolutely. One of the initiatives I took on when I first came on board was changing the paradigm of our perceptions about homelessness. And what that was designed to do was to really tell the story of individuals who are homeless, to tell their stories, to help everyone understand what a day in the life is like. In one case, where a donated bicycle is employment, because now that individual can get back and forth to work by riding their bicycle. Or a sense where, again, clean clothing, just being able to have work boots. So I have an opportunity, but I don't have work boots. So having those work boots donated, again, that provided that individual with employment. So we want to tell the stories of individuals who are experiencing homelessness. And once you start to see individuals as human beings, then you're more likely to want to support their efforts. If you can walk down the street and not see a person, make a person invisible, you can treat them in very poor ways. But once you see that person, I see you, I see your plight, I see what you're going through. Let me help however I can. And that's our goal, to change the paradigm of the perceptions about homelessness.
And I have another question, but before I do that, we're approaching the 7 o'clock hour, maybe in about 6 minutes. And I just want to make sure I thank the listeners on WGPL 1350 AM for listening as we transition into Facebook only. So when that 7 o'clock hour comes, it might happen. So we'll continue our discussion. I lost my thought on the next question by going there. But anyway, as far as, and you mentioned about, the perception of panhandling and things like that, so the distinction, the difference between panhandlers and the homeless people, homeless citizens. How hard is it trying to get people to understand that fact? And you just explained pretty much, the education that you try to give to people to let them know this, and the Colonel mentioned your one paycheck from being homeless. Is your message getting across to the people?
I think so. I think so. You know, in addition to that message, we also want to the community to know that responding to the issue of homelessness is a community response. It's not just what PVH does. That's your job. You do that. You take care of it. But this is a community of our own citizens who are experiencing homelessness. And so we will oftentimes go to the community and say, we need jeans, and here are the sizes. So please, if you can donate jeans, or we need sneakers or thermal underwear, because we want the community to have an opportunity to buy into the solution. Now, at the end of the day, when we try to make the distinction between homelessness and panhandlers, the one thing I've learned in my life, that there's a difference between understanding and acceptance. So a person may understand that there's a difference between panhandling and homelessness, but they might not quite be ready to accept that there's a difference. So now I can just keep on doing what I'm doing, and I don't have to worry about these individuals who need my help and support.
And one more question, please. Go ahead, Leah.
While James is thinking, how long does one be a part of your program? Is there a time limit as to how long they can be in the program that you have now?
No, ma'am. Currently, there is no time limit. Before, even when we were sheltering with the churches, we might have sheltered from mid-November until May. The service center is open year-round. And so as long as that individual needed support and assistance, then the services were available. As I said before, when a person comes to us, they are probably as broken as they have been. No access to family, no access to resources. And a lot of what we do is daily coaching to say, you can do this, you can do that. And it takes time to sort of build up that self-esteem that a person gets to a point where they start to believe that they can take on these little tasks. The small tasks might be just getting their ID, getting their birth certificate, getting a social security card. And we celebrate all of those. So yay, you got your ID. Now you're one step closer to what you need to do. And it just increases their self-efficacy, the sense that I can do better. And more importantly, that I really do deserve to be housed. No matter what I've done, I deserve it.
And I know that you partner with that partnership, the PHAC partnership. So when someone has advanced, they've gotten their driver's license, they've gotten those things they need, they've gotten their job, how do we provide for transitional housing?
So we do have a process, and it's a case counseling process. So housing may come in a variety of options. There are some options that have been specifically identified for individuals who are experiencing homelessness. It's called an SRO, or a single residency occupancy. And then it might be a tenant landlord situation, or under a program called Shelter Plus Care, where the person has mental health, substance abuse. It could be rapid rehousing, where 1 month, the first month's rent and security deposits are paid. So it's a variety of options. And of course, all of them are resource constrained. So through that case counseling, the agencies within the continuum actually present the client, and then there's an assessment done that gives a number related to their vulnerability. And that's how we keep the process objective.
You know, it's interesting what you said. You just laid out a multifaceted plan to help people. And it also goes back to that the status of being homeless is multifaceted, because yes, even though I may be working poor, I could be homeless because one, there's no affordable housing out there.
Yes, sir.
The house or the apartment that I lived in has gone up and I no longer can afford it. My credit is messed up because I messed up a few payments, and now I've got a bad credit score. Now I can't apply for an apartment because I don't have a credit card. I have bad thing, and nobody wants to give me a lease because I got bad credit. And then I look at it, I can't even get a job because now I have I've had some problems with the law, and that stays on my record forever. And I also got jacked up credit, and now I'm out of my apartment that they just kicked me out of. And then so I'm starting layering things now, and now I can't even go to work now because they fired me because my credit's all jacked up. Now I'm a security risk. And so now that one check that I talked about before, I'm now homeless.
Yes.
And so I'm glad you talked about what we can do. And it's like what I'm hearing is it's a building blocks of trying to repair somebody's life. And that's where you have to go. Because it's multifaceted. It's just not one issue that makes you homeless.
And to have that coach along the way that says, let's help you navigate this process. Yes, you can do it. Just take it one step at a time. Yeah. So to have that coach alongside helps. Mm-hmm.
And you also have families that are homeless. They live out of cars or whatever.
Absolutely, absolutely.
So it's just not the one single, man or woman out there. You have entire families, and so we need to step up to help.
And there are some provisions for families, but not much. What is there for families who are? I know many times people stop by the church and they say the kids and I, we're sleeping in the car. We have no place to go. What provisions are there for families?
Well, the city does have a family shelter that is operated by one of the providers, by the Her Shelter. And again, it is, I think it's about a 25 person facility. So a couple of families can take advantage of those services and do a really good job of moving people through those processes into resources when they're available, housing resources when they're available.
And once again, James, we want to encourage everyone out there. I know Jackie Kendall is just pushing. Donate, donate, donate. So on the Facebook page, Jackie has put where you can donate your monies for Portsmouth Volunteer for the Homeless. They need those donations in order to provide the services that they're providing for the homeless citizens of Portsmouth, Virginia. So don't forget to make those donations. James, I'm sorry.
Oh, that's okay. One thing I'm finding out now at this age, when the thought comes to mind, you write it down.
Write it down.
So what I want to ask, a big part of your name or your organization's name is Portsmouth Volunteers for the Homeless. Now, how would someone be a volunteer, and what kind of criteria would you be looking for out of that volunteer, and what kind of work would they be doing?
Thanks for that question, James. Coming from the American Red Cross, where in all of our work, we had a volunteer partner. So at that time, any leader within the organization also had a volunteer leader counterpart. So I'm very passionate about volunteerism and wanted to grow that. So we have volunteers who actually serve as shelter leads at night. And so the entire shelter operation is under the leadership of that volunteer that we have, of course, trained. In any given season or between November and May, that volunteer leadership, those volunteer leadership teams could give us 2,000 plus hours of service. So they have an assigned night and they show up every single night. So since November 2019, that volunteer cadre has been showing up every single night to do their jobs. We traditionally would do a volunteer orientation, but because of COVID, we have not. So for individuals who are interested, they can give our office a call. We are looking for volunteers who can make a commitment to a time frame. And they can give our office a call to fill out a volunteer application. I believe that you get volunteers in and you get them trained and you get them to work, because people come to you for meaningful opportunities, and that's what we want to provide.
Now,
So as you look for these volunteers,
is there an age restriction to the volunteerism as far as when they can start, how old they can start?
Yeah, the volunteer needs to be 18. If not, they need to be accompanied by an adult for the entire volunteer time.
So college students could be very well
Yes.
involved.
Yes, and we've done internships as well with some of the local universities. We've had students to come out as a part of their curriculum to volunteer. So we will identify a meaningful opportunity to serve.
and other than the volunteer as a lead person, what other volunteer opportunities are there? If they don't want to be a lead person, but they want to volunteer to work at the shelter, what can they do?
So we can always use help with what we call attendance. And the attendants help our clients get settled in the evening, provide support if they need materials, go get that, with cleanup, of course. And then at our office, COVID has done a lot of things. So when people are at home, they've had more time to organize, and that means they have more donations. So we have a lot of donations that need to be sorted and organized at our office. A lot of times volunteer service is not just frontline, but it might be technical. So IT wise, to make sure our systems are operating and connected efficiently. So we also look for back office volunteers as well.
Now, does the city have a plan as to, I understand there's a proposal out there, if I'm not mistaken, as to a plan that they have for some volunteers for the housing. Would you share that with us?
Well, what we have seen so far is there is a proposal on the table utilizing some of the America Rescue Plan money to actually develop, construct a homeless shelter for single adults. So we do understand that that's on the table, that a location has been identified. There are some steps that absolutely need to take place, but it has been on the table for a while. And so we're very excited about that.
Great, great.
You know, one thing you talked about your office and to contact you. Could you give us your office phone number where people can call you?
Yes, sir. It's area code 757-399-0200.
And I think Leo mentioned the volunteers, and you said it had to be over 18. So does that preclude, as I look at my kids and grandkids that have gone through, when they were going to high school, they were part of the International Baccalaureate programs, and they needed to get volunteer hours out there. So because of their restriction of 18, could they still volunteer with you during the daytime with parent consent to volunteer?
They actually have to have a parent accompany them. Yes. Because we cannot take responsibility for the supervision of a minor. And so we have had adults who come and bring their minor children with them to serve. It's just they have to be accompanied by an adult.
Good. Okay. Yeah, because that is a good piece that the kids can get, build their resumes for as I build my portfolio for college, is to put that on my thing. So that's the reason I bring that in. Yes. And it also builds character and talks about their life. Yeah.
And we have also provided volunteer opportunities for individuals needing to do community service. And that is not just sorting and organizing, but it's actually engaging with the clients so that who knows, this might be their turnaround if they actually get to engage with individuals and learn about their struggles and their opportunities. So we also provide volunteer opportunities for community service as well.
And we know you take financial donations. What other, I know you're saying the items to be sorted. What type of items are you having donated, or did you need donated?
So we do have donations come in for clothing. Right now, we would only be accepting seasonal clothing. So things that are winter related, always in need of cleaning supplies, personal items in terms of lotion, deodorant. We try to provide everything for our clients that we would reach for at home. So all of those items as well. In terms of operationally, garbage bags, kitchen trash bags, cleaning products, hand sanitizer. We're doing okay with masks and socks. So those are some of the things.
Dr. Washington, a few years back, it was a report about the homeless population in the city of Portsmouth was getting older, and you were experiencing a lot more people over 50. And I think that was back in 2018 or before the pandemic. Is that still the case now? We're still trending to older homeless citizens?
Yeah, unfortunately, yes. So we have a large population that we are serving who are 62 and above. And it really is unfortunate because it's the loss of a spouse that may lead to the loss of housing, or a health issue that might lead to loss of housing. And the other thing that we're seeing, if we look at things from a collective community, is that a lot of people are living in subsidized housing units, which means it limits your ability to bring in a loved one who needs shelter. So you have an older and aging parent, but if you are in subsidized housing based on the laws and the rules, you can't bring that parent into your household. We have elders who are homeless and don't want their children to know because they're embarrassed. They really want to try to get themselves back together. So it's, again, changing the paradigm of our perceptions about homelessness. It's not necessarily someone who just refuses to work, wants to be on a system, it's not, that's not the story.
And also, we concentrating now, of course, on the winter, the cold weather, which can affect homelessness in any age. But we also, and hopefully we'll have you on as we approach the summer, because it's also important. Those hot days are just as devastating to someone with no place to go as the cold weather, and sometimes even worse, the heat strokes and things like that. So we have to be aware of that. And you all continue during the summer to try to do the same things as far as keeping people cool as well, right?
Yeah, as I shared, our service center is year round. And so our service center is open. Pre-COVID, we were open 8 a.m. until 2 p.m. Hopefully we work with city partners. At some point, the city opens cooling stations where individuals can go. A residential shelter facility is a solution to a lot of different things. It's not going to be the magic bullet because people still have free will. There's still affordable housing gaps, but it's going to be a big help for our city.
And I want to say one thing. I want to say that we have on my page, I have a Gary Harris who is a listener or of ours, and he has quite a few statements and questions, but I think some of the questions he's asked, you have answered. So I'm just going to ask you later on, go on my page and look at some of the statements and questions that he made that you might find interesting. I can't address all of them here today, but do that. But one thing I wanted to mention, you do have a board, a volunteer board, and they play a very important role as far as the success of what you are trying to do in the city. Could you explain what their role is actually?
As I explained before, we have a governing board and not a managing board. And so the difference is a governing board focuses on governance and not day-to-day management of the organization. That is the responsibility of the executive director. But what the board does, it assists in establishing policy. They recruit new board members. They do fundraising. Members of our board serve in capacities like the financial secretary and the treasurer. So they do grants management, the financial grants management, ensuring that the reports are submitted. They're a part of our accounting system to ensure our stewardship and our accountability to making sure that we have all of our documents in place, our audits, our tax filings. So they take care of those responsibilities as well.
So you said that your board members actively seek other people to become part of the board. And what if a person would like to serve on your board? What would they do? How would they go about becoming a member of the board for the Portsmouth Volunteer for Homeless?
What they would do is contact either a current board member, or they would contact our office to speak to me, because they would have to be recommended by another board member.
And is there a time period in which they serve?
It's a 2-year service. Since we have had COVID, we have extended that. And so we do have some individuals who've been with us for quite a while, and we still do have vacancies as well.
Mm-hmm. So once again, we want to encourage everyone out there who's listening and who's on Facebook Live to make your donations to Portsmouth Volunteer for the Homeless. They need not only the financial piece, which is the most important piece, but they also have many other items that Dr. Washington has expressed that they need as far as to the day-to-day operational needs. So don't forget to make your donations sooner than later.
I'd like to echo what Leah just said, and she said it so eloquently, because one, the homeless issue and is not a phenomena of the city of Portsmouth by itself. It is a nationwide issue, and
Absolutely.
that it affects all walks of life. Homelessness does not say you be black, white, brown, purple, or whatever, or Republican or Democrat. It doesn't go, or independent. Homeless, anybody can be homeless.
Absolutely.
Because of issues that affect you and can just take you out, and you just never know, it just hits you. And then so great organizations like Dr. Washington is talking about, and others are out there, support them, because as you support them, you're part of the solution, and you want to get on the tip of the spear. And that's what I have to say. Yes.
Thank you, Colonel. Thank you.
So you all are housed in the same building or complex as the Oasis? The Oasis?
Yes, we are co-located. Yes.
So how is that relationship between the two?
We have a great partnership with our colleagues over at Oasis. We have different missions, which is good. So there's no duplication of service. And it is an example again that there is a continuum of care, and each of those agencies specialize in a particular area. And we sort of serve in our lanes, and then we coordinate services so that we can have a more effective impact.
So that's so important to recognize that, because so often we see organizations and they're doing the same thing, and a lot of times people are not serviced as well. Everybody knows their role, and like you said, you don't want to see duplication of services. You want to make sure that it's enough variety out there for the people that you serve. So that's a good relationship.
Yes.
As we wind down, we really appreciate you getting up early and coming in here and explaining or discussing, the Portsmouth Volunteers for the Homeless. I think a lot of people know about it, but it's always those people out there that never heard of it and need to be informed about what's going on. And also that you are a nonprofit 501(c)(3). So sometimes 501(c)(3). So sometimes that helps people who want to contribute, knowing that they can, do a little tax thing with that. So.
Right. Nonprofit in good standings. And once we receive donations, we do provide a tax receipt to the individual so that they have that for their tax filings.
That's good.
So once again, before we go off the air, give us the address where they can send donations. I'm focusing on these donations, whether it's monetary or whether they're items for day-to-day operation. Where can they send these items?
Yes. So our office is located at 800 Williamsburg Avenue, Suite B, Portsmouth, Virginia, 23704. And financial donations can go to our Facebook page at the donate button.
And they're really doing a great job. I see it on a daily basis, because where they're housing the homeless individuals is right in the building that I'm in. So I see what's going on. I know they keep plenty of goodies in there for them to eat as well. So they are well stocked, which is a good thing, and provides a good home-like feeling down there at the work center where they're housing these individuals. So I do want to commend you and commend your team, because you're doing a great job. And as I say, I see it on a daily basis. So I commend you for all the great works that you're doing. And I know that the citizens of Portsmouth are going to get behind you and support you, and to make sure that you remain as successful as you are. So I want to thank you for the great services that you're providing for the city of Portsmouth.
Thank you, Ms. Leah. Certainly we could not do it alone. We are just exceptionally grateful to Sheriff Michael Moore and the team at the Sheriff's Office who made this opportunity possible. We've been there since March of 2020, and I gotta tell you, we've had no client to test positive for COVID or no one to get sick from COVID. So it's a team effort. We have strong public health protocols in place. And, we could not do this without the support of the community and our team.
And then Dr. Washington, just before we go, I wanted you to mention, because before we went on air, we talked about the relationship over the years you had with the churches in helping out, and COVID sort of broke into that and sort of made it a little more difficult. And your statement, I want you to repeat what you said, how you all had to pivot, and how in some ways it made you stronger. Not to, you still need that support from the churches when you can go back to that. But I thought what you said, how you had to pivot and it made you stronger in order to continue that same type of service the homeless citizens expected.
Yeah, James, we didn't want to lose either our support with the churches. So we do have an Adopt a Week initiative, because the churches can still keep their weeks. It's just a drop-off service. But we did have to pivot very quickly. We had to start purchasing things to actually physically change the environment to keep separation. So, curtain rods, dress racks. We had to, get hand sanitizer and masks and written protocols in place about social distancing, how we do intake. All of those things had to go into place very quickly, and then get our team trained on it. And we were able to do that. Knowing that we had the sheriff's release center to go into, ease that stress. And so we were able to focus on the operations.
Mhm.
And the last thing, can any groups or organization offer, like the sheriff is doing, offer space if they have it to offer for you all, if it fits all the protocols that y'all have in place? Or you have to be, I know you have to be kind of selective, but I'm just putting this out there for somebody that might have some space that would want to, donate that space or some time in that space to y'all.
If they did, we would keep that as a contingency. Right now, we do have a stationary location where we are being supported and welcomed, and that actually plays a lot into our public health protocols, so that we're not going from place to place to place, not really knowing what the cleaning protocols are, or the practices. So that actually is a major part of our public health protocols right now. So we're going to stay where we are for as long as we can be there.
Okay, that sounds good. And with that, we will close out. And thanks again, host. We appreciate that. And
Thank
also,
you.
everybody, remember, this is the month where we celebrate a year as Portsmouth Coffee Talk.
Yay, 1 year for Portsmouth Coffee Talk. Yay.
Happy anniversary.
Before we end the month, I guess we'll talk about this. We'll have a show where we'll just discuss. We have about almost 50 some videos out on YouTube, and we're going to discuss some of those, hopefully discuss some of those discussions and some of the people we had on Portsmouth Coffee Talk. So stay tuned and keep in touch with us all month long, and we appreciate you. We appreciate you listening. Portsmouth Coffee Talk is here for our voice,
Our community,
In our future.
and our future. Thank you, Dr. Washington. We appreciate it.
Thank you all again for the opportunity and the support. We look forward to continuing our relationship together.
thank you so very much.
Thank you.
And as James mentioned, don't forget to tell those on your board who may have missed this morning that they can go to YouTube, Coffee Talks YouTube page, subscribe and like our YouTube page, and they can see you and hear all the wonderful things you shared with us on this morning on that YouTube page.
Thank you.
Thank you. Take care, everybody.
Okay,
right.
thank you.